Welcome back to our fourth edition and the very first one of 2026 of Clinical Conversations. I am Natalie Jones. I have the pleasure of serving as Senior Vice President of Clinical Practice and Innovation at Prolink. And I am so excited to have today one of our strategic partners from Grapefruit Health, Eric Alvarez, with us today. So I would love to start with having Eric to really share his introduction and also talk a lot about his background because we are just so gifted to have him with us.
Yeah, thank you, Natalie, for inviting me on the pod here. Happy to be here. My name is Eric Alvarez. I'm the CEO and founder of a company called Grapefruit Health. We're headquartered here in Chicago. We will be turning just 4 years old here in a few weeks, and very proud of that. As far as my background goes, I have a great wild story of how I got into healthcare, but maybe just starting at the healthcare part. Day one was in 2009 when I was accepted into a MHA program. It's a top three program at Rush University Medical Center. And it's a unique program where you actually work for the health system the entire time you're in the program. I also interned for the American College of Healthcare Executives that summer under Tom Dolan, for anybody that remembers way back then, and now is led by Deborah Bowen. And right before I graduated, I got a role at University of Chicago Medicine in service line administration, quickly kind of climbed the ranks there. And by the time I left, I had roughly 150 FTEs, 9-digit budgets, worked with a lot of talent organizations while I was there. I learned firsthand a lot of the issues and problems around workforce challenges, literally on the front lines. I did that again at Northwestern Medicine, similarly. But I was an entrepreneur at heart. I've always wanted to do this stuff full time. My first company growing up, I was 13 years old. I did oil changes at people's houses, grew up blue collar in Chicagoland. And that company, I was the COO and first employee at. We grew that over 5 years, got acquired by Cerner in 2020. And so I had the hospital operations experience. I now knew how to take these kind of wild ideas and actually turn them into really functioning, profitable venture capital backed businesses. And that experience gave me some unique insights. Meanwhile, I was also adjunct faculty at Rush. I teach a course there as adjunct. I also sit on a nursing school board at my Southern Illinois University in Carbondale, Illinois. And so listening to students and what they need and what they're looking for and how I can help them achieve those things. It was really the convergence of those three experiences: hospital operations, healthcare education, and this like startup innovation ecosystem that gave me the idea around Grapefruit Health, which I'm happy to tell you more about.
Let's jump in. I'd love to hear really how the connection was made because when people think about what you do in this space and why um, we're connected through this work, maybe we can start there.
What happened with Grapefruit Health is I was working with a lot of students and they were asking me for internships and part-time jobs, and I was like, this is Chicago, you could throw a rock. Like, we have so much medicine here, we have so much healthcare associations, we have pharma. It is like a mecca for healthcare. And they're like, yeah, but I can't work 9 to 5. My Tuesday is different than my Thursday. I don't have transportation. I have finals. My schedule changes every quarter. Who's going to hire me? And I'm like, wow, that's a really good point. And so what Grapefruit Health really is that infrastructure that allows a clinical student, nursing, social work, pharmacy, pre-med, dietitian. We're mostly nursing, but we have over 30,000 students in our network. And then they are able to work for healthcare organizations remotely, safely, and around their schedules. To give you an example, we employ at any given time about 300 clinical students. And through our software, they engage with patients on behalf of our clients to coordinate care gap closure. So we do a lot of med adherence. We do a lot of post-discharge follow-up. We do a lot of like at-home test kit return engagement. It's all that high volume coordination that that requires a unique model to handle a lot of that seasonality and provide that value. So we're able to give back and do that. There's actually 1 million clinical students in the country at any given time, and so we're just interacting with a fraction of them. And along our journey, Prolink on their partnership side, on their strategic partnership side, heard about what we're doing. And that individual had reached out to us and kind of kicked off a conversation. But I'll pause there. But that's kind of how what Grapefruit Health does. You could probably see the synergies with Prolink there. But there was a initial reach out, and here we are.
Absolutely. And I think the synergy is overlapping because it is certainly solving for the workforce shortage with a creative solution, but it's also innovative. And I came to ProLink from the healthcare system side. And what fascinated me about the work that you're doing and leading is that you have met students where they are, not only nursing students, but any healthcare students in that 1 million population. And we need to engage them sooner. I wonder how when you think about the work that they're doing, and how they're working alongside you to solve for some of those very complex needs on the outpatient side. How do you kind of connect that back to how we're solving for the healthcare shortage?
Yeah, great question. So what we find in a lot of our provider clients, maybe less than some of the payer vendor clients, but in our provider large health system clients is they often have positions budgeted for that are open, and we're short across the nation by 3.2 million healthcare workers, right? And oftentimes you'll have nurses doing a post-discharge follow-up or some of this other case management work that doesn't always require clinical licensure for the lower acuity portion of the role. And so what you can do is you can bring in a Grapefruit Health. We're about half the cost of a W-2. And so you could bring in a Grapefruit Health to do a lot of this low acuity engagement we're high trust, we're SOC 2 in a very compliant manner, and allow your current clinical staff to really level up, okay, to address those kind of things. And so that's one way we're addressing the workforce shortage on the front line of our business. The second big part of our business, we've only are employing about 300 clinical students at any given time, but we've had over 30,000 students apply that we manage relationships with, and we engage them and we provide them with free resources, which we have a new one coming out, which I hope you asked me about, our AI training tools. But those students we want to help our clients recruit, and we're doing that today through our partnership with Prolink, where their organizations will have access to a larger talent pool. So those are the two ways we're really addressing the workforce shortage.
And that pipeline is just so critical. And the training and the exposure that you provide to these young people is just also critical. And the work that you're doing with those colleges to bring that pipeline closer to the industry. Could you talk more about really kind of the training and how these students are indoctrinated into healthcare and how you're working with them? And also, Eric, mention some of the types of students that you have there, because I think the audience would love to know more about that.
Yeah, sure. Yeah. So, today the way the process works is a student will hear about Grapefruit Health. We have about 1,100 partnerships with different clinical programs across the country. Our applicant pool is growing significantly. The number is actually larger than 30,000. I just didn't look it up prior to this meeting. I think we're north of 40 now. Wow. And we should be at over 100,000 by the end of this year because of some new initiatives. And so they'll hear about us, they apply. We then have some tools. They submit a video application, they submit some other assets, and we're able to determine and pick out the very, very best of the best students for this type of work. We then bring them in. They go through, again, because we're high trust and we're SOC 2 Type 2, they need to go through background checks and they need to get sorted through that kind of level of compliance. Once they're in the Grapefruit Health system, they go through extensive training on the work they're doing. So some of it is, I call it soft skills. So therapeutic communication, motivational interviewing, how to talk at the right cadence for, an elderly patient that has English as a second language versus a Gen Z patient maybe that you can talk a little bit, you're talking a little bit faster, talking their language. And so that's the soft skill component. And then we're actually teaching them on the skill they need to know how to do. So if it's med adherence, how to go through the scripts and handle that, how to escalate patient care for suicidal ideation, or if you're detecting any of these other things we call red words, which need to be escalated to to licensed folks. And so they do that. And what they're getting when they're with us, we have incredible data that shows, first of all, our students give us a 91% NPS score, which is hard to do in any business or any in any kind of part of the world, I guess. The second part, and what we're really proud of, is this massive amount of confidence that they build in communicating with patients, and then also their skill set that they're developing from before they start with us till after they start with us. And then what our provider clients love is, wow, these students have now spoken to our patients. They understand our culture. They understand what's important to us. And now as they're graduating, they're the perfect candidate to come into this organization. So this is like a very, very, very novel talent pipeline for them. And it's sort of I don't love the term try before you buy, but you're really knowing the candidate. You can actually see their work. You're not just going off a teacher's reference letter or a very thin resume. You actually know what they're capable of. And so I think that makes it a very powerful system.
So much is packed in there. One of the things when you talk about the soft skills, as you're looking at these students to determine if they have that real skill set to be able to be successful in the virtual environment, is just so key. And how you've created a curriculum that helps them to understand how to work in this virtual land is something I wanted you to also maybe share with us and talk about as you're thinking about the future, and how some of those skills are just critical to, these are going to be just foundational competencies that students have to have as new graduates in this healthcare environment.
Yeah, no, great question. I mean, to take it even a step further, there's literally now, and this has been true for a while, and it kind of ebbs and flows, but you're seeing CAP scores now, right? Patient satisfaction scores actually impacting reimbursement. And when you survey patients, regardless of how skilled a clinician is, clinically or technically, if they don't have the bedside and the ability to communicate, a lot of things fall apart. Right. And so it's really, really hard, I think, to be an effective clinician if you can't communicate. And so day one, the person that leads clinical services for us is a PhD in nursing. They are a nursing school faculty member. They've trained and worked with hundreds and thousands now through Grapefruit Health, clinical students. And so we've been able to perfect that curriculum for the things that we need. What we're doing now, and oh, by the way, we use retired clinicians on the back end for our quality assurance. So we don't take anybody off the front lines. We employ retired nurses to audit these interactions and listen to these recordings, and they act as a mentor and coach to these students. Which works really, really well. And then from a scalability perspective, we'll probably be at over 1,000 live students this year. How are we going to continue to train and ensure that QA in a very, very scalable way? And so what we're able to do now in partnership with Google is we're developing and launching here in just a few weeks an AI training tool. It's an AI patient, really. We built these really funky interfaces on the front end that are all gamified. So the students log in, they create a profile, because again, we've only employed 300, we have 30,000. We want to give something more to them than just applying to be at Grapefruit Health. They log in and they're going to go through different modules. And as I mentioned earlier, they're really scored on two things. It's the soft skills and their tactical skills. And how do we know if they're doing a good job in our training environment is because we have millions of these recorded interactions, and we know how well each one of those interactions have been scored by our retired clinicians. And then the model is able to infer how well a student's done in those training environments. So we're able to give them an actual score, and they have to get better and better to pass the module. And so the modules are all themed. So there's ones around med adherence, there's one around post-discharge follow-up, there's ones around checking in on seniors and isolation and loneliness. We're also embedding in the empathetic component. Are they being empathetic? Are they talking at the right speed? I talk very fast, I'd probably fail. But are you talking at the right speed to match your audience? And it's a very, very powerful tool. And the amount of times you can use it and practice with it is unlimited, right? Because it's consumption based. And so with our partnership with Google, it allows us to do these kind of things. And again, we have all the scripts, we have all the assessments, because we've been doing this for so many years now. We've been able to bake it in. The original purpose of this tool is to train only the students that work for Grapefruit Health. But we said, hey, look, if it exists, why don't we give it out to every single clinical student for free? And that's what we're going to be doing here in the next few weeks. We're really excited about it.
Do they walk away with a micro credential or
They do. They do.
yeah,
It's our own credentials, but what we want to do in the near term is we've had a lot of clinical programs that have heard about this and reached out, and some that we want to that we'll be piloting with this version of it, which is the clinical instructor and faculty can actually go in on the back end and create their own scenarios. So they can say irate patient, um, hard of hearing, med adherence, and then throw in this other, a suicidal ideation scenario, or I feel dizzy, I think I'm about to faint, and how the students can actually interact with that. The clinical instructors then have access to the outcomes of those interactions and can evaluate further beyond what the AI component's doing. And when they do that, they can actually get hours towards their degree. It can be part of their clinical instruction through simulation hours, to do that. And so with Grapefruit Health doing it without a clinical instructor, yes, you get a Grapefruit Health certified telephonic communication certificate if you do 40 hours of dialogue in our training environment. But we're really excited about how this can accelerate the development of clinicians, because obviously we have a massive shortage. We have a huge bottleneck of internships and preceptorship and everything in clinical education, especially around nursing. And so we don't know yet. It's like one of those things. We're really excited to launch it and see what it does. But the future looks bright.
it's really exciting. I to hear that, because potential of conversion of hours or even the thought around competency based education and how that could equate to hours and just the different learning environments. We learned so much coming out of COVID around ways that we needed to be more innovative and creative in putting things in front of not only young people but just learners overall. When you think about the pipeline, you touched on it, just the people that are teaching them. Did I hear you say that you use retirees or nurses that are more advanced in their career to teach them? I'm really fascinated with that when we have, for the first time, five generations that are all working alongside each other. Talk more about your core staff and maybe some of the ways that you're bridging that gap between this future generation.
Yeah. So when we call them patient champions, but when a clinical student goes live on our platform, they've already, of course, have done shadowed calls and they've been monitored like wallflower style, and then they're kind of out in the open, right? They're actually like using autonomy to interact with a patient for the first time in their lives, right? And so with once they're launched, their first 20 interactions are all audited by a retired clinician. So these are folks that are out of the workforce, because we're not giving part-time work to active nurses. What we don't want to touch the very, very sensitive and fragile and too small workforce. Those that are already retired and out, they're really excited to give back and want to mentor and be part and still contribute. They just don't want to be working 50 hours in the ICU, right? So they work with Grapefruit Health. We actually compensate them and they interact and they're able to give direct feedback to these patient champions on how they're performing. So today it's all manual. The retirees get it. We're not going to get rid of that program fully, but with this AI listening on the training side, we are going to eventually bring that into our production environment. But we love that, and the nurses, the retired nurses that we select for the QA problem or the QA workflow are ones that are not the old adage of like nurses eat their young, et cetera. These are they're very sensitive to the fact that these are students and that they're sensitive to the fact that they need this guidance and help. And it's worked exceptionally well. And it allows us to stay on mission. For a while there, we thought we were going to hire active clinicians to do this. But then I'm like, how can we say we're helping the workforce shortage if we're yanking people in to do QA? So we wanted to kind of stay on brand. And so it's, again, it's worked. You can almost create you can almost do what Grapefruit Health does with retired clinicians, if you wanted to
I
go that
love
route.
it. I
Yeah.
love it. Because to your point, so many healthcare systems have a hard time figuring out how to keep that group engaged.
Yes.
And we're experiencing already the brain drain And we have these the baby boomer population and so many people with retirements, and so that solves for so much in terms of they still have so much to offer, but they're
Yeah.
solving for a different problem in a
Yeah.
different way. And then it sounds like you're getting them up to speed also on some of the technological pieces. So I can see the students even teaching them as much as they're teaching the students.
Yeah.
When you think about AI, there's lots of sensitivity in healthcare right now in terms of how we
Absolutely.
incorporate it. How do we use it as a resource to not necessarily replace people, but help us to have more synergy and just be able to run faster and more efficient? Can you
Yeah.
talk a little bit about what you're hearing that's emerging in healthcare in terms of and in education and the business that you're in terms of use of AI?
Yeah, I would love to. Yeah, I would start with saying I think AI has got a lot of promise. I would say in general, what I'm seeing as far as patient facing AI, there's a lot more hype than there is reality, but that's normal for any new technology, right? I mean, I'm trying to think of good examples, but like, flying cars or like, like anything that's come out or electric vehicle, it just takes a while. Or if you're, old enough, the EMR, right? Meaningful use in 2010, 11, 12. When that came out, it was supposed to be like an overnight thing. And there's still physicians out there, believe it or not, are documenting on paper, right? And so there are a lot of promising functionality around AI. And I think it really depends on the client type. And so for provider organizations, which I think is who we're mostly speaking to today, there's certainly some things that I think could be done with AI, and they should be, especially not patient facing. So like, I'll give you an example. When I'm trying to get meetings with prospective clients, I'm still working with a EA, an executive assistant. I'm still working with an executive assistant. We're emailing back and forth over and over again, which would be a perfect use case for AI. Yet they want to replace a surgeon with a robot. It's like wild. It's like, hang on, let's crawl, walk, run here. And maybe, I had a doctor's appointment the other day actually, and it was still paper forms, right? So I just kind of laugh about healthcare is kind of funny to me that we're starting at like the end, the most important part, which is the patient interaction, the human being part, when all of this administrative stuff, all this back end paperwork, data, rev cycle, prior auth is a disaster, ripe for AI because it's repetitive. There's a pattern. There's not like this human variability to it, right? Why are we not going all in on that part, fixing it as the crawl, maybe the walk, and then getting to the human interaction? All that being said, and the human interaction component, because that's the world we sit in, I think AI has a lot of really good uses cases for certain populations. But it almost certainly, and I think even AI groups would agree, it can't exist by itself. So for example, we have a client where we use some of our AI outreach for health risk assessments, right? HRSNAs, community health needs assessments, SDOH surveys. This population's older that we're working with, and over 50% say agent, 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 agent. They want a human. So it's great. So we get about 35% of them done in a very cost-effective, automated way, but you still have to have a human pairing. Medication adherence, I don't think is a good use case for it. There's too many instances where you need to escalate to a human. You might need to do a comprehensive medication review. You might need to get to a pharmacist to rewrite the script, your dialogue. There's just so many ways to mess that up. And so why are we going to that? I don't know. I just don't know. So the AI advances are getting better. They're getting stronger. We're obviously using it in our training. We're using it in other parts of our business, like in accounting and back end office-y stuff. But we do subscribe to the idea that healthcare is very human. It's human today. We take a high accountability approach to that. We found ways for the economics. Again, we're about half the cost of a W-2, so we're competitive priced with AI anyways, and AI is only getting more expensive out there. But I think I think it's very promising. And if we deploy it in the right ways, like AI for fraud, waste, and abuse, that's probably a good place to put it. If we apply it towards the right things, I think it's going to have the better splash. It's going to get a better return on investment without upsetting people, right? No one's too worried about smoothing out and making those administrative processes more efficient. I think you have everybody's supporting you. When you start to try to do clinical stuff and engagement and outreach purely with AI, I think we're jumping the cart a bit.
100%. And there's so many benefits when you started to talk that I thought about in terms of healthcare systems being able to partner with you and partner with you in a lot of different ways to relieve the administrative burden. And there's certainly a movement in terms of understanding the value of nursing, understanding how we can keep nurses really practicing at top of license. Could you maybe share just some additional benefits maybe we haven't talked about, especially when I think about revenue cycle? Because as we know, payment and pay structures have just changed and evolved so much. So how
Yeah.
do we figure out how to bring these services in and really they pay for themselves?
Yeah, like I think a great use case for us is like post-discharge follow-up. We have a great case study with Winchester Hospital in New England where we were able to reduce their readmissions by 13%,
Wow.
and the work and the cost of doing that work by over 50%, simply by having us call every single ED and inpatient discharge, whereas before they were only focusing on the higher acuity. And you just don't realize there's could be a lot of reasons that are related to the actual procedure or the admission originally. And so when you have a solution like ours that's charging, $2.50 per reach out here with onshore U.S. citizen, incredible talent that in 1 year is about to be a super expensive rare resource. That's like the labor arbitrage component. We're going to help you do a lot more for a lot less, and we've proven that over and over. We have over 500,000 lives today that we work with, and we're moving the needle on all of them. And if we weren't, we'd be out of business, right? That's the one thing about, I think, in healthcare, especially if you're not, we don't sign multi-year deals and things like that. But if you're not effective, especially at clients like Optum, they move on. You know what I mean? So the proof's sort of in the pudding, if you will. If you're watching these companies grow year over year and they're retaining their clients, you have to assume, with some skeptical, you should be skeptical, but like you should assume a little bit that they're probably doing okay on there. The other ways that we're adding value, again, is back to the talent pipelines, this high level of engagement with their folks, and the fact that we're human beings allows us to escalate to ourselves when somebody says agent. It also allows us to navigate the Telephone Consumer Protection Act, if people are familiar with that, where you're not allowed to use robocalling and IVR and text messaging without consent, which isn't always a big problem for providers, but it is for our payer clients out there. So it's, I don't know. Somebody called us the other day, it's like the easy button for care gap closure coordination. So,
Definitely the easy button and the lucrative button. Oh,
yeah.
it pays for itself. It turns a profit. I could just see the recidivism rate, readmission rates reduce. You can see the dollars and not even know what they are,
Yes,
just
ma'am.
by what you just shared. So, as you think about all of that, we've talked about so much today. What's on the horizon over the next year for you? What are you thinking about? Where's your vision going in terms of grapefruit?
Yeah, great question. Being only 4 years old in B2B enterprise healthcare is like still like, feels like day one, but I think we're on day two. So the last, 3.5 years or so was a lot of like experimenting. We've always provided the service that we're mentioning today. Like we started in senior isolation and loneliness, and that's how we got our name. When I think about a happy, healthy senior living their most independent life, they're like in a commercial eating a grapefruit, and like we love the colors. And from there, it's just expanded into all these other use cases. And I think we finally found the best application for our core business, which is around care gap closure coordination, and that's just taken off for us in droves. And so what am I really excited about for the next, let's say, rolling 12 months is to land these additional big clients that we've just brought on, which we're really excited about, to scale those up. We're excited to launch this AI training. I think that's going to like put us on the map. We're still a relatively early small company, but when you're creating something that innovative, I think it's going to get a lot of attention, and we'll be punching way above our weight for that. And then just lastly, and this sounds kind of cheesy, I'm excited to keep doing what we're doing. Like, it's a really fun business to be part of. Students get to learn while they earn. Healthcare organizations are doing more for less. Retired clinicians are getting this new kind of meaning in post-retirement and some income. And then most importantly, patients are getting the care that they can't get today because the economics don't make sense. Whereas we made the economics make sense, we make the scalability make sense, and we're able to provide this high touch, empathetic care to these huge populations.
And that is why we're in partnership. All the things that you've mentioned are just so aligned. It's the same partners, the same healthcare systems that we're working with or would like to work with, and it just makes sense for us to help them to create that vision and have it to come to life, by improving their margins and outcomes and replenishing the workforce pipeline in healthcare. Is there anything else you want to share around your vision for how Prolink is working with you and in this innovative space?
No, I think I would just say thank you for the opportunity, both from a partnership perspective and ProLink being innovative in themselves and forward thinking enough to go and seek out partnerships like Grapefruit Health, knowing what their clients need and how to bring that innovation to their front door, right? And so they have a lot going on. And so ProLink going out and being proactive and doing that kind of thing, I think it's a great differentiator and it's a great service to provide your clients out there. So yeah, just thank you for that. And then obviously thank you for the opportunity to speak today. Appreciate it.
Absolutely. Thank you so much. We're just so excited to continue to work with you. Usually during these conversations, I would ask and end with, what's that magic wand? I'll just say, if I had the magic wand, it would be more of grapefruit and more students to replenish the pipeline and the synergies and all the things that are a dream come true in the workforce innovation space. So thank you, Eric, for all that you're doing to lead this very, very important work in this industry.
Yeah. Thank you, Natalie.
Thank you.